Good afternoon, everybody. I'm Sarah Rosen Wartell, lucky to be the president of the Urban Institute and to welcome you here today. Let me first start by saying that I hope you and all of those that you care about are healthy and well and surviving this very challenging time. I'm really glad that you could be with us today for what is the fourth of our series of discussions with leading policymakers and urban analysts about questions that are emerging from the COVID crisis. Let me do a couple of quick housekeeping matters first. This event is being recorded and the web stream will be available. All participants are muted, and if you don't yet know how to use the Q&A box at Zoom, you will today. Please send us your thoughts and questions. We'll answer them if we can, and we also, knowing what those questions are, gives us agendas for events in the future. Please consider joining the conversation on Twitter and social media using the hashtag #LiveAtUrban. At the Urban Institute, we're thinking about this crisis really in three steps. First, how do we help to strengthen our country's response? How do we support plans to get us to a recovery sooner? And finally, how do we build reforms that will help build resilience to shocks for families, communities, and our economy so that we come back stronger for this crisis with a more equitable and inclusive economy? To start, I'm thrilled to be joined by Senator Tammy Baldwin. Senator Baldwin is going to join us for a conversation about whether subsidized jobs should be part of our economic recovery. And then after we chat with her, we'll also have a conversation with two other terrific experts on this topic. We all know the grim statistics that over 30 million Americans have filed for unemployment claims since this pandemic began, and the number is continuing to rise. We suspect tomorrow that the Department of Labor will release an unemployment report with further grim news. Already 22 million jobs were lost last month. A decade's worth of job gains have been erased. And it's now clear that rather than flipping a switch and going back to where we were, we face a staged process of gradual reopening and perhaps iterative steps backward and forward before we're able to resume something looking like a normal economic recovery. Through the CARES Act and other legislation, Congress has made important steps to address the immediate response and provide some measure of stability through the near-term crisis. But to begin to work on what a longer-term recovery will look like and to make sure that more of our at-risk workers can participate, more and more voices are calling for new and expanded programs to create and subsidize jobs. Leading that pack is Senator Tammy Baldwin, representing Wisconsin, who's led a group of 5 senators to call upon their colleagues in the Senate to join with them to design a national subsidized employment program to help unemployed and underemployed workers regain wage-paying jobs, and where needed, provide job training and supportive services when it is safe to go back to work. Senator, welcome, and thank you so much for being with us.
Thank you. It's a delight to join you, and thank you for leading this discussion.
So why don't we start with, would you tell us what propelled you to write this letter?
Well, I think that when we begin to reopen the economy, given the massive job loss that we're seeing, the record and unprecedented numbers of people seeking unemployment benefits, the fact that not every business will reopen, that we're going to need every tool in the toolbox at our disposal in order to help people who have been unemployed for a long time connect with or reconnect with jobs. And subsidized jobs or transitional jobs have been a very, very effective tool for many, many years now. And I think it's going to be needed in the instance when we begin to reopen. So I want us to be thinking about it now, thinking about how it needs to be ramped up.
So I noticed you've written and spoken about the importance of public sector employment even before we were in this crisis, back at a time when we had rather than 20% unemployment, more like 3.5% record lows. And I've noticed that in a lot of your speaking about this, you've talked about the dignity of work and why work is so important. A lot of our policy remedies that we've been talking about have been just putting income in the hands of people. But as we start to think about reopening the economy, this effort is really focused on bringing people back to work. Talk about why.
Yes, so, I do think a lot about the dignity of work and how sadly in our economic structure, we have often not rewarded work the same way we reward, say, wealth and the accumulation of wealth, whether that be in our tax code or certain practices that we allow the powerful to engage in. That means that the fruits of people's labor inure to the benefit of others rather than being reinvested in the workers, in worker training, in modernizing workplaces to meet 21st century standards. And I think we got to get back to something that was much more present before we financialized so much of our economy, which is, if you have a profitable year, that's because your workers worked hard and that they deserve to be recognized and rewarded for that. And that could be in many different forms. And it also helps build stronger communities when the fruits of people's labor don't go 1,000 miles away or halfway across the globe.
Well, Senator, the country has history going all the way back to the Great Depression with public works programs of different kinds. And there's evidence even from most recently the Great Recession in your own state of Wisconsin of some important public work type programs. Can you talk a little bit about what sort of lessons you're drawing on here?
Well, I will say that Congress did focus significantly on subsidized jobs as one of the tools to bring us out of the Great Recession. And in Wisconsin, particularly under the lead of organizations like UMOS and the Milwaukee Urban League, there was a significant success in bringing folks who had been unattached to the workforce for significant periods of time back in and reconnecting them. And those sort of transitional jobs programs did recognize that if you'd been separated for a long time, often it wasn't just matching an individual with a job. It was also helping sort of create wraparound services that would ease that transition process and provide the support that the worker needs in order to make a success of a new job, but only on a transitional basis. So at some point, the person would become a full employee of whatever entity they were working with. I would say the criticism I have for our effort with subsidized jobs post recession is that we didn't make it permanent, and we have to really scale up our efforts looking at what lies ahead, which is going to be much greater in magnitude than the Great Recession was.
One thing I noticed when you wrote this, you didn't write a bill, you wrote a letter. And you wrote a letter that was really addressed to your colleagues saying, come join me. Let's think about, there are lots of different kinds of public employment jobs. You could give a tax credit to an employer for creating a new job if you can figure out what's a new job. You could simply have government hire folks and build things like we did in the Great Depression, and lots of models in between. tell me a little bit about why you took this approach to your colleagues, and then I'd love to chat with you a little bit about what you see the prospects for additional legislation in Congress ahead.
So a couple of reasons. First of all, transitional jobs and subsidized employment is a model that's been around for a long time. It is something that has gained bipartisan support over many, many years. And our ability to be able to scale it up to meet the challenge of these times would be relatively easy compared to starting things from scratch or restarting something that hasn't been around since after the Great Depression. That said, I also like the idea of surrounding the support of the wage earner, of the worker, as opposed to starting with the employer. The employer benefits, don't get me wrong, whether that's a public sector employer, private sector employer, for-profit, not-for-profit. But I think that the investment needs to be in the worker. And in transitional jobs, that often is additional supports that makes this a long-term success and permanent re-entry into the job market. And that's one of the things I really do like about this approach. The other piece of this, aside from it having had long-standing bipartisan support, is that, believe it or not, I am not the only senator who has introduced legislation around subsidized employment. And so I particularly started with a number of colleagues who have had their own legislation, perhaps modeled a little differently for different reasons. But we all kind of go back to that idea that this is a tool that we're going to need it desperately, and it works.
Just make sure to credit that Senator Van Hollen, Senator Booker, Senator Wyden, and Senator Bennett all co-signed that letter with you. And also note that the program that you've described thus far, at least in the letter, has been one in which potentially within some parameters, there might be different ways that they would be implemented and designed by states. So talk to me just briefly about the prospects for further, generally for further legislation about COVID-19 recovery. After a brief comment suggesting that we needed to pause on legislative action, more recently, the majority leader has talked about Republican priorities for the next bits of legislation. I think they're somewhat different than some of your colleagues on your side of the aisle, and then the president has identified his own list of different priorities. So how do you see a chance that these are going to come together, and when do you think we might see another round of congressional action?
Well, I would say that for some of us, work on a fourth emergency response package started even before we passed the interim CARES package just a week and a half ago. And certainly the day after that was achieved, we earnestly dove into talking about a number of different things that you would obviously look at. One is what needs fixing or adjusting or just mild tweaks in the previous packages to make it more equitable, to make it reach the folks that we really want to reach and may have been left behind. But secondly, what are we seeing emerge as challenges, as crises that haven't really been addressed in the previous CARES Act and the two acts prior to that. And we're certainly hearing a lot of that. I spend a significant amount of my time reaching out to various constituencies in the state of Wisconsin, sort of what's working, what's not working. And so I think it's very likely we will pass another measure. I am hearing, and sort of hot off the presses, that the House is very close to being able to unveil at least an outline of their fourth package. It's varied whether the initiative has started in the House or in the Senate. The House is clearly going to begin this. And I think that it's going to be a very robust and ambitious plan because we know how much need is out there.
And I hear you saying that House plans and Senate Democrats, that the circumstances you believe mean that there will be coming together with your Republican colleagues around some package yet to be determined. And you think there's a good chance, that's as a question, not a statement, that employment-related programs could be part of that?
I do, because we are already seeing some states begin to relax safer at home or stay at home rules. And we also know that if certain states are sort of following a blueprint of first waiting for the rate of positive tests to go down before they enter phases of reopening. But this is going to be a long process, and employment and reemployment is going to be, the next wave of challenge, given a pandemic that, a health crisis that created an economic crisis. I also think that one of the conversations I actually had earlier today was with somebody who believes that their situation would be such that they wouldn't open until the third phase of reopening because of the need to have social distancing. And there are going to be various phases to reopening the economy. So there's going to be people who are unemployed for longer periods of time. And of course, those businesses that don't make it and can't reopen. So I do think that getting people back at work will become an ever increasing priority as time goes on.
Well, thank you for raising it and trying to look just a little bit out past the horizon of the immediate moment. I think my colleague Demetra, who will speak in the next session, has written almost exactly the same thing, that we need to be planning now if we want to be able to start to think about how we would execute something like this in a relevant timetable. So we're really glad to hear from you, and thanks for joining us all, and wish you good luck in the period ahead. Best wishes for Wisconsin.
Thank you, my pleasure.
All righty then, thanks Senator, and I'm now pleased to be joined by Demetra Nightingale and Indivar Dutta-Gupta. If you can turn on your cameras, great, thank you guys. Demetra is an Institute Fellow at the Urban Institute. She was the Chief Evaluation Officer at the U.S. Department of Labor from 2011 to 16, where she developed what is widely recognized as one of the premier evaluation units in the federal government. And she has written and recently called on Congress to act early to create a program for workers who may have a hard time getting a job after the public health crisis dissipates. Indy is co-executive director at the Georgetown Center on Poverty and Inequality. He's helped to develop various national subsidized employment proposals and done work to model their impact on reducing poverty and inequality. He also serves on the board of the National Academy of Social Insurance and is a member of the Poverty, Employment, and Self-Sufficiency Research Network. Thank you, Demetra and Indy, for joining me. Really appreciate it, and for your work on these topics. So let me start with what's ahead. And Indy, let me turn this to you first. As the economy begins to gradually reopen, tell me a little bit about what should we be expecting? Some people have talked about a V where we spring back, or maybe a curve where we gradually come back, and other people are starting to fear that we may be looking at something more like a W with up and down. What is the labor market going to look like over the next year or two? Any ideas?
Well, yeah, I mean, thanks, Sarah. I've been doing this sort of work just long enough to not make any confident predictions here. But let me just say that it always takes more time to hire than to lay someone off or furlough someone versus rehiring. And that's just sort of just a fact of life. And on top of that, there's going to be some changes in not only sort of consumer tastes and preferences, which drive a chunk of our economy, but also in the capacity, physical, human, otherwise, of various enterprises to reopen. I've been thinking a lot about childcare centers. We just put out a piece with the National Women's Law Center on helping childcare centers navigate the various support options in front of them for with regard to the workers and themselves. And the fact is that they may not quite look and feel like they did before. So I worry a lot about the fact that it took us the longest economic expansion in US history really to get to a somewhat tight labor market where you finally saw some of the most vulnerable workers getting hired, like people with criminal records. And I don't think that we want to wait 10 years again for a situation like that.
It is those population when we start to reopen, is your sense that they will be first or last to be hired back?
Right, they'll of course be, I think, among the very last to be hired back. I mean, some of the great research from MDRC and others, I think shows that it's going to be a challenge when you're competing against all these other workers who don't face the same barriers to employment. And to be clear, some of those are labor market discrimination and things that, you know, I think subsidized jobs can sort of help overcome, but aren't the sole answer to. So I really do worry a lot. In the 2008 financial crisis, we lost, you know, under 9 million jobs relative to the sort of need, arguably, and it took 80 some months to close that jobs gap. And I think that I hope we've learned a lot, and I've been impressed to some extent by some of the response, including from the Federal Reserve Bank, but it doesn't mean that it won't take a long time.
Demetra, you know, in essence, Congress has a bunch of different tools that it could start to work on. We saw this already, that we have helped with direct cash and unemployment insurance to help people sort of follow through, safety net supports to help people manage through a period of severe unemployment. We also can start, once the economy reopens, to train them from work or try to match them to openings. We can use public resources to create or incentivize the creation of jobs, or we can do a combination of all of the above. This conversation is really about public resources for job creation. Talk to me about why you think that that tool needs to be part of the mix for part of the recovery, rather than, for example, just extending unemployment insurance for a longer period of time.
Well, the economic distress that we're going through right now is likely to be deep, and it's going to take many months, as Indy said, to recover. That really means we need a mix of approaches, and also we need to also have a recognition that some people, even if they were full-time workers before, may not be able to find full-time work as they're re-entering. So that we need a mix to help people to find the jobs that do exist in their local areas, and that no one policy or program is going to be enough. In other periods of high economic stress, we've had two approaches that I think we're going to be thinking about more. One is federal investment in infrastructure, such as public works and transportation, maybe broadband expansion, other technology, environmental sustainability. And that kind of infusion of federal funds will have the effect of creating jobs, possibly a lot of jobs, depending on the level of investment, if the investment is high enough. And the jobs would mainly be in the private sector and not direct job subsidies. But the other major piece, which we're talking about mostly today, is a large-scale publicly subsidized jobs program that would directly subsidize jobs in the public sector, the nonprofit sector, and possibly the private sector as well. And at a minimum, the subsidized jobs provide an income for people and for their families, but it also provides useful public services, community services, because of the extra workers that are needed. For example, as we're coming out of the pandemic, we may need more resources for more social services, more community activity services, more public safety, more social services, health-related, supplemental work, childcare in the schools for education. So if training is also incorporated into some of the subsidized jobs, you might actually see people be able to shift into new occupations as they open up.
Great. Indy, there are lots of different models for subsidized jobs. Demetra just pointed out that in essence, when we do public spending, we in a sense are also creating jobs in the private sector economy, and sometimes in the public sector economy. So that's a form, if you will, of public investment in employment. But there are also ways of providing subsidy to existing employers for job creation, or directly delivering, if you will, a subsidy to the employer through the worker. Talk a little bit about some of those different models and what you think is required here.
Well, look, one of the insights I think Senator Baldwin shared with us was about making sure we use every tool in our toolbox. And I think that there are sort of trade-offs or different reasons to use different approaches. First, I think we've all seen this with the attention to the unemployment insurance system, but no one approach can necessarily take the stress of the enormous need out there. So is there a case for something like a tax-based subsidy for employers in a broad sense to get them to, say, rehire folks who have been furloughed? Yeah, there might be now in a sense that we wouldn't have necessarily thought that before this crisis. But primarily, in my opinion, what subsidized jobs allows you to do is a few things. One, it allows you to be much more tailored, much more targeted, take on specific barriers, use community-based organizations and intermediaries. Say, for example, Sarah, you all have put out terrific research, I think just today, on how certain communities are experiencing much, we can talk about it later, but much more financial hardship. Subsidized jobs allows you to really sort of target those communities. In the past, it's often included, as we've discussed earlier, folks who have criminal justice system involvement. So I think that the idea of giving a subsidy sort of more tied to the worker, ideally to create jobs that you wouldn't otherwise have for people who otherwise wouldn't be hired, right? So you're limiting some of the potential downsides and maximizing your sort of intervention there would, but in my eyes, be an essential way to ensure that the larger, more sort of widespread or sort of really more blanket policies, like take the Paycheck Protection Program, those programs are really helpful, but they won't help you ensure any sense, I think, of equity. And that's particularly important in this crisis.
Demetra, if you would speak to the equity issue, we certainly have seen that, and then I'll come back to you to talk a little bit more about this, Indy. We've certainly seen, and you were referring to a report my colleagues released from some survey that we've been doing that suggests that families that are seeing job loss are most extreme among Hispanic families, and I think the Washington Post survey today confirmed that same experience. Understandably, a lot of the jobs that have been closed in the service industries, like restaurants, food worker, the like, and entertainment, particularly many of those jobs are held by Latino families. We're seeing that the healthcare impacts on Black families in the United States are extremely severe, disproportionately so. So those communities are definitely suffering in this crisis. What does evidence tell us, Demetra, about who gets served when we have different types of both transitional work or subsidized job programs? Demetra, you're on mute, I'm sorry.
certainly there's a need for targeting if you want to reach the individuals with the most need, which might be the lowest income individuals or the lowest communities, or the highest unemployment communities. And one way that you can do that is through a program that has a two-tiered strategy, because the unemployment rate is so severe. A subsidized employment program that's more general, that's available for the unemployed or for people who've been unemployed for a certain period of time, the so-called long-term unemployed, makes sense. But the other part of it would be more targeted on the low-income population. So it would be an income-driven approach. We know that that there are some big positive effects of subsidized employment, and one of the largest rigorous demonstration tests of subsidized employment was in Milwaukee, the New Hope project, which targeted 2 low-income neighborhoods for a period of 5 years, and guaranteed that if people were working full-time, their income would be above 150% of poverty for their family. And if they couldn't find a full-time job, they were given a subsidy to fill that slot. The results were very positive. So they could either have a full-time subsidized job or a part-time subsidized job. They also had childcare and other kinds of services. And there were positive effects certainly on income during the subsidy period, and some positive longer-term employment effects. The biggest equity effects, I think, were for the children. Child well-being was positively affected, both because of the income effect of increasing income for the family, but also for the stability that having long-term employment over a period rather than an up and down, as you said with the W, that has a positive effect on the family and on the children.
So I want to bring you both to talk about a question we got very early in this session from the audience, which was really about much of our workforce development programs. Some of the best models are very closely integrated with support services of different kinds. You've mentioned childcare, workforce training. If you're talking about a design of a subsidized job program, is it just about the subsidy for the job, or what else is entailed?
Well, if you think about Demetra's architecture of 2 tiers, you could easily think about one tier as really just about the job, where folks, by and large, but for a job being available to them right now, wouldn't have some of the sort of struggles that they're facing. But there is certainly going to be a group of people, and I should be clear, I think there's always people facing some of the challenges that our justice system creates. Limited English proficiency for say some recent immigrants in some cases, mental health challenges, which are actually addressed in many subsidized jobs models, and so on and so forth, legal barriers and others. And I think that universe of people is going to be larger now than otherwise, right? I mean, we're hearing about the mental health crisis, just as an example. That's really burgeoning at the moment. And so I think there's a case to be made for some group of folks that some wraparound supports and services would make more sense. This is a unique crisis. So, some programs in the past have helped with things like transportation. That may have seemed like something that only a small group of folks would have needed previously, but in a crisis like this, I mean, I think about especially urban areas where public transit has collapsed, and intentionally so, to save lives. There may be all sorts of new needs. And one of the things that I think we have to do in any subsidized jobs program right now is to ensure that we give flexibility primarily to states, but I think there's a case to be made to also give some competitive grants directly to community-based organizations, because unfortunately, some states aren't going to participate no matter how generous really a program is. But we need to balance that flexibility with accountability. So we have, in some of the proposals that we've worked to develop over the years emphasize the need for states to aim for, explain, and actually hit targets, say, for example, closing racial gaps in employment rates in a community.
So we are talking here about jobs that could be in lots of different sectors, including in sectors that may be heavily needed in a society where some of these new health needs, whether it's contact tracing or if a lot of our childcare centers were to fail in this period, figuring out safe and trained ways to provide additional care to individuals. I just wanted to each of you, a lot of people hear subsidized jobs, they remember WPA, they remember a sort of a whole new workforce of federal employees. I don't think that's what you're envisioning here. And Demetra, why don't you start? Just talk about who are some of the different kinds of people or the different kinds of employers that could end up getting this work, and what are some of the public purposes that might be achieved through subsidized employment in a post-COVID recovery?
Right. I think that there are really a whole range, and over the years we've gradually broadened the subsidy programs to include private sector as well as public and nonprofit sector. Part of the challenge is mounting up and getting enough jobs set up for people at the time that they need it. So that's another reason why it's important to start planning early, because it is a huge job just to get enough positions in place. In the nonprofit and public sector, those are jobs that are readily available with subsidies, and the nonprofit organizations are struggling right now. We know that community-based organizations are having a huge financial problem right now, and they are sort of the framework and the foundation for community action and community support. So those jobs could be filled quickly, and it's a range from direct services, administration, and clerical activities as well. There are public agency jobs as well. And then there also could be private sector jobs in a form of a subsidy that traditionally in the workforce system has been through on-the-job training, where there is a shared cost of the wages between the government and the employers, so that maybe 50 or 75% of an individual's wages would be subsidized for a period of 6 or 9 months or a year. And the expectation is that those jobs would continue. There's more of a chance that the jobs will continue and that the individuals are able to transition into a regular job in the private sector than in the public sector and the nonprofit sector, because they don't have the resources in the nonprofit and public sector to hire up. So we need a mix in order to make sure we have a longer term employment situation.
And let me just ask both of you one question that came from the audience. This model of subsidized jobs maybe is in contrast or in complement to the value of work sharing. Folks would be interested in hearing what your thoughts about work sharing maybe and how it might relate to extended unemployment insurance as part of a broader suite of policies that might be necessary in a very challenged labor market. Gundi, Indy, why don't you start, and then I'll come back to you, Demetra.
You can tell I'm eager to talk about work sharing. I mean, this is one of those things that we knew after the financial crisis and really before it that we needed to scale up, and we never got it done. It's a federal state partnership. For those who don't know, work sharing essentially allows employers to reduce hours for workers, typically across the board at a work site or at the entire enterprise, and keep health and retirement benefits. And what the workers get in sort of exchange is they get partial unemployment insurance benefits to help make up some of the difference. Right now, they also get through July $600 in pandemic unemployment compensation benefits, which is really critical. So I think, again, this is just another important tool in our toolbox that we have to maximize. Work sharing is a great way to retain employees in certain sectors. I mean, imagine a restaurant, for example, that can do takeout and delivery, but isn't seeing the revenue that it was seeing before. Depending on the state, again, you can reduce hours 10 to 60%, and maintain staff and keep them whole, in some cases temporarily, somewhat better than whole financially. That's a big deal. I mean, that maintains attachment to work. Again, but work sharing is not a substitute for really anything else that we're talking about here. It is just a massively underutilized complement. Subsidized jobs, the way that I think we think about it, is by and large a way to either, again, get people into positions that just wouldn't otherwise have existed, and usually people who otherwise wouldn't have been hired at all, never mind necessarily in those positions, and use it for wraparound supports and services, though I think we should take very seriously the sort of two-tiered approach Demetra laid out that I think argues that you may not need such wraparound services and supports for a large share of the participants. And it's done through in community-based organizations by and large, who again can help with targeting. Work sharing is done just directly with the employer, partnering with the State Department of Labor. And I'll just say before hearing Demetra's thoughts on it, a lot of people don't know, but the federal government said it was going to pick up 100% of the cost if a state had in place a work sharing law. And if it didn't, but decided to come into an agreement with the Department of Labor, it would still pick up 50% of the cost of work sharing benefits. So everyone who can really should try to take advantage of the program.
So Demetra, as much as I know you want to speak to that, I'm going to ask you a different question. You're going to be super fast in answering both at the same time.
Okay.
Because we want to close out here, and I have one last thing to say before we end, which share some resources. So one of the things we haven't mentioned is protections in these programs, both protections for the workers and protections for the taxpayer, so that we're not simply allowing a state, for example, have layoffs and then have federal subsidies then pay for those same employees. Particularly worry about that in the private sector. Do you have thoughts about what kind of protection, just conceptually, not all the details, that we ought to be thinking about if we end up designing public workforce programs like this?
Certainly, protection certainly for wages, prevailing wages should be high enough for people to support themselves and their families, but not so high that it discourages them from getting a regular job in the regular labor market. Second, there must be guarantees and provisions to protect workers' safety and health in the workplace. Third is protecting the collective bargaining rights of regular employees so that the subsidized jobs are not displacing or replacing regular workers. And the jobs should be meaningful jobs, worthwhile jobs, and not just make work jobs. So not just be an income transfer, but actually doing productive work. And the other protection is on the accountability side, as Indy said, is to have strong provisions for accountability so that employers, state and local governments are not just using the federal funds to pay for something they would have been paying for on their own, so that it's added value. You want whatever investment the federal government is doing to be added, not substituting other costs.
That's terrific. We could probably talk about this much further, but I really want to thank both of you for joining us and mention to our audience that the Urban Institute webpage for this event will put up a couple of products, including some of the things that Indy mentioned. And I also want to particularly steer you, we just released a new feature that's a series of short essays about the possibilities of a jobs recovery program. We also have this feature mentioned where low-income jobs are being lost to COVID-19, which allows you to open up, and based on the employment makeup of every census tract in the country, we're predicting where the job losses are, in some cases updating that with real-time data as it's being released from the states. So you can, at the community level, look at particular places and understand where the job loss is most likely to be severe, and think about targeting programs to communities that are most in need. I hope that tool and others are helpful. Let us know what would be helpful to you. We hope you will join us next week for another one of these sessions. We're going to be looking to how healthcare philanthropy can be helpful in the COVID-19 recovery. But thank you all for being with us, and we look forward to seeing you again soon. Thank you, Demetra. Thank you, Indy,
you.
and thank you to the Senator.
Thank you, Sarah.
Bye, everyone.